Good day to all. In this session, we will discuss about one of the most challenging aspect of the course in Associate Fellowship in Industry and Health, that is how to write the thesis. This is Dr. Jaren James, Assistant Professor in the Department of Pharmacology in SRM Medical College Hospital and Research Center, Kattangalattur, Tamil Nadu. So the project work that is supposed to be carried out by the student is a real hands-on experience in the field of occupational health. So whatever project or whatever topic the student is undertaking should ideally focus on real world issues in the field of occupational health, that is involving factory workers, mines, dock workers, etc. So this project work should be an original work and it should really contribute to the field of occupational health. So there are various guidelines that is incorporated by the DG Fastly. So this is project work is supposed to be carried out by the student in the third month of the course, and it is ideally the student is ideally supposed to be finishing this project work in a duration of 10 days. And all work that is carried out by the student should follow biomedical and health research ethics, and it requires approval from the institute faculty, and it is ideally exempted from the institute ethics committee approval since it is a. Coming to the structure of the project report, so the manuscript that is written by the student can carry a maximum of 5,000 words, and it should be a hardbound copy like we do for other postgraduate medical courses. Out of the two copies, one copy can be retained by the student and one will be kept at the institute. And these copies should be duly signed by the medical faculty who is in charge of guiding the student. So the pre-planning of the research is very important because this is carried out as a research project as part of eligibility to appear in the AFIH exam. So this topic that is selected by the student should be ideally interesting to the student, and it can also be selected based on his previous work experience in a particular area. So again, these topics can be selected based on availability of resources and easy access of data materials near the institute. Suppose if there are some particular industries near a research institute, the students in that institute can be asked to prefer doing research in such industries that are nearby the institute. And it also should be relevant to the current scenario of occupational health. The fine-tuning of the topic and the various parameters that are analyzed in the study can be finalized after discussion with the research faculty. The main objective of this session is to help the candidate how to write the thesis. So the student has finished doing the study or getting the data. So now the next part is to write the results and perform the analysis. So each thesis will have different components. Okay, so all research articles will be in the form of an IMRAD. That means it will have an introduction and it will have another section where the methods will be discussed, and in the following session results will be discussed, and then there will be the discussion. So in IMRAD format means introduction, methods, results and discussion format. So that is the format that we will be following for AFI thesis also. So we have discussed a title initially and we have finalized the title and the student has carried out the research as well. Then after performing the research, the student will be analyzing the data, okay, and then he will be coming to certain results and certain conclusions, okay. So based on the results and overall idea, he will be writing a structured abstract for the thesis, okay. So even though this comes first in the thesis, this can be ideally written at the last. After writing the thesis book, he can write the structured abstract. Then the results, the structured abstract will be followed by some keywords, and then we come to the main part of the thesis, in which the introduction will be the first part. The student will be giving an introduction in about 1 to 2 pages about the relevance of the topic and the public health importance of the topic, followed by a review of literature. He will be explaining in detail what other researchers have already found about the topic and what is a lacunae of knowledge in these relevant areas, and he will be comparing the results with of various different studies. In the next session, he will be discussing about the various methodologies that are used in a study. For example, some questionnaires or some scales that is used in the current study will be explained in the materials and methods section. In the results and analysis session, whatever results that student has obtained with respect to his area of research will be explained in detail with the help of tables, charts, pie diagrams and other things. And in the following session, he will be discussing the results in detail as to like compare with the previous and other existing studies, how his results are different or are similar to previous similar studies. And finally, he will be giving a conclusion about his results and then followed by the references. So each of these components we will be discussing in the following sessions. The first component that we will discuss here is the title. So the student has to very carefully plan when he is formulating the title. For all randomized controlled trials, there is a format that is prescribed for the title that is called as PICOT format, in which P stands for population, I stands for intervention, C will stand for the comparator, that if we are studying some particularly, for example, one drug with another existing drug or one new method of evaluation with older method of diagnosis or something like that, we will that is called as comparator. Then outcome, what is the outcome in that some parameters that we expect, and the time frame during which the study is carried out. So since this AFH thesis is carried out in a short span duration of nearly 2 to 3 weeks, it is not sure how far the student will be able to be sincere with these guidelines and all. So most of the time the student will be either carrying out a survey or a cross-sectional study design, to be precise. So at a point of time he will be analyzing the prevalence, or he will be analyzing that various morbidity, for example dermatological morbidities or respiratory morbidities or other kind of disorders that is prevalent in a particular type of industry within a short period of time. So most of the time these kind of the important terms, for example the population, what kind of industry workers they are, whether they are oil factory or oil mining or what kind of, or any electrical manufacturing unit, that kind of industry has to be mentioned. What are the parameters that they are going, major parameters, for example respiratory morbidity, like that, such things needs to be mentioned in the title, and we will discuss these with suitable examples. So ideally the title also shouldn't be very long. It is what is actually told is that it should be less than 20 words, and it should contain what, who, where. It is, for example, where the study is conducting. These three things have to be definitely mentioned in the title, and it is always also better to avoid use of acronyms in the title. Like always, we advise the students to avoid use of short forms in title. And the title has to be reviewed again and again, because once you have formulated the title, it is difficult to change, because like any other important parameters, if you are changing during the course of the study, that also becomes difficult if you have formulated the title and if you have started working on it. So here are few examples. Okay, so evaluation of prevalence of respiratory morbidity among workers in a cement factory in central India. So what the student is going to analyze here, he is going to analyze the prevalence of respiratory morbidity, and where he is going to, in whom he is going to analyze, he is going to analyze among workers in a cement factory, and it is located in central India. Sometimes we can mention in eastern India or in Tamil Nadu or in Madhya Pradesh, and it is always better to mention the type of study design also. So this will be a cross-sectional study or a survey kind of study in which the student will be analyzing all these factors. So if for the following sessions, we will be using this as an example in order to explain the various sessions. For example, prevalence of respiratory morbidity among workers in a cement factory in central India, a cross-sectional study. So this title also we can formulate in various other styles. For example, a cross-sectional study on prevalence of respiratory morbidity among workers in a cement factory in central India. This is the same study, both are same only. So I have formulated this title in a different style. So another, this is prevalence of respiratory morbidity and its determinants among workers in a cement factory in central India, a cross-sectional study. So all these are the same study which can be formulated in different styles.